Media. Hi, and welcome to the Media and Health Symposium at Virginia Commonwealth University. We will give everyone a minute to join us for this panel, so please stay with us. Hi, everyone, and welcome to the Media and Health Symposium at Virginia Commonwealth University. For those of you who are just joining us, this is our second research panel. On this panel, we will explore uses and influences of social media and health communication. Our speakers are Tracey Thomas, Courtney Schrock, and Daniela Friedman from the University of South Carolina, Roma Subramanian from the University of Missouri, Jing Taylor-Wen from the University of Florida, and Queenie Lee from the University of South Carolina. And lastly, Marcia, DiStaso, and Michail Vafeiadis from Pennsylvania State University, along with Chelsea Amaral from Solomon, McCown, and Company. And our discussant is Brooke Fisher-Liu from the University of Maryland. So each of our speakers will present for 10 minutes, and you will have a chance to ask questions and discuss the presentations with them at the end. Please post your questions on Twitter using the hashtag VCU Global Health. You can find speaker bios and their Twitter handles on our symposium website, or just simply follow our Center for Media and Health on Twitter at VCU CMH. We can get started with our first speaker. This paper is titled The Use of Social Media in Times of Crisis, a Systematic Review, and it will be presented by Tracey and Courtney.
Let me just start this slide. All right. So this is Tracey, and I'll be presenting along with Courtney. So I'm going to do the first part of our presentation and then pass the baton to Courtney. This project was based on this systematic review was conducted last fall. We worked with our professor, Daniela Friedman, to really look to see how researchers are evaluating the use of social media in times of crisis. The purpose of our study was to systematically review the risk and crisis communication literature on the use and evaluation of social media use in public crises. We know that during emergency events, more people are turning to social media for emergency-related information. And we also know that more organizations, governmental agencies, emergency responders are using social media to communicate emergency-related information directly with the public. So understanding more about how social media has been effectively used in this context is important to informing the development of best practices for future use. This tweet is from Governor Tomblin of West Virginia. He tweeted this on January 9th of last year in response to the chemical spill that occurred in West Virginia that contaminated the drinking water of 300,000 people in the state. My dissertation research is focusing on traditional and social media coverage of that incident, which ultimately served as the inspiration of this study, of our review, because I was really interested in learning more about how researchers have studied the use and examined social media use and the methodologies that they used in doing so in the context of public emergencies or disasters. And of course, we've seen with the Ebola crisis that many people are interested in the use of social media in this context, and I imagine that this time next year, researchers are going to have a lot of great knowledge to share with us based on their findings of research based on its use during this particular crisis. In terms of our methodology for the systematic study, we looked at major public health, communication, and environmental science databases using keywords including crisis information, risk communication, emergency communication, in combination with terms related to social media, including the term social media itself. Our inclusion criteria for our review consisted of the following: articles that were published between January 1st, 2004 to really correspond with the introduction of Web 2.0, and September 1st, 2014, which is when we, probably the day we started the review. And we were interested in articles that primarily or centrally focused on social media use during public crisis events, so not kind of internal or organizational crisis situations. We were looking at articles that were published in English, included in peer-reviewed journals, were empirical in nature, and then, of course, that were available through our library system. We developed a 25-item coding form, so just a few examples of the types of information we were coding for. Crisis type, so is it a disaster or a man-made disaster? And then we would also specify the particular event. So if it was Hurricane Katrina, we would write down the name of that event, of the title of the event. And we also coded for social media attributes, so really looking and identifying the aspects of social media that the researcher was interested in the study. Social media type and platform, so was it a microblog, was it a social networking site, and the platform itself. And then in terms of design methodology, we coded the design in terms of if it was descriptive, quasi-experimental, experimental. We also coded the specific methodology used, so content analysis, interview, and then we also noted the type of analysis that was used, so qualitative or quantitative. Courtney and I were the ones who coded the articles. We ended up with 77 full-text articles, and before independently coding those, dividing and coding those, we determined intercodal reliability based on a 25% sample of the, so 19 articles from the 77. And we resolved any disagreements through discussion until we achieved 100% agreement. And then upon achieving agreement, we went on to separately code articles, and ultimately found that 25 of our full text articles met being our inclusion criteria. And so this is the flow diagram of our article selection process. As you can see, we began with 259 articles, and then we removed duplicates and screened abstracts, and then ultimately ended up with 25 after removing from the 77 that we coded together any articles that were not empirical or that were not focused on a public crisis event. And now I'm going to stop sharing and let Courtney begin, because we're at two different computers.
Trying to figure out how to share this right now. No.
You click on the green arrow on the left side of the screen.
Right, and then here we go. Okay. There it is. Okay, so the articles that we coded were from 17 different journals, and they each fell into 6 broad research categories. The majority were from public relations and public administration journals. The majority of the articles were published in 2013, which is likely due to the continued increase in social media use worldwide and the numerous public crises that have occurred in the year 2013 or in the immediate years prior. But we'd like to note that 2014 was only a partial year. We only pulled articles from September 2014, nothing beyond that. The majority of the articles focused on risk and crisis communication during and after natural disasters, while others were more descriptive studies versus quasi or experimental. We found that a content analysis was the most common method used. Also, blogs and microblogs were the most commonly reviewed, with Twitter being the most studied platform, followed by Facebook. Among these messages on Twitter and Facebook during or after a crisis, message content and message structure were the most common aspects of social media that were discussed and reviewed in the articles. And surprisingly, more articles identified the limitations of social media use than the benefits. Ooh, I think I started to talk farther along than I was in the slides. However, only one article we included in this review included author-generated best practices in social media during crises. So, in conclusion, we definitely anticipate more research on this topic in the future because 80 of the articles we reviewed were published in the last 3 years. This presents an opportunity for public health researchers, particularly those interested in disaster preparedness, response, and crisis communication, to contribute in the future to this literature by expanding the understanding and the best practices of social media during these emergencies. So some limitations that we came across were the facts that we were probably missing relevant literature due to the time period that we collected and reviewed abstracts and articles. We also made a point to exclude articles that focused solely on organizational crises or personal risk. Therefore, future analyses should focus more on organizational crises and may also consider focusing specifically on risk communication, crisis communication, since uses, benefits, and limitations of social media may differ according to communication purpose and type. There is also a great opportunity for researchers in the field of public health to be published in and around this particular subject of risk, crisis, and emergency communication, particularly via social media in the context of a public health crisis. A good example would be the recent Ebola situations that we experienced in the past year. So in conclusion, we'd just like to thank everyone for your interest in our review, and we enjoyed working together, and we look forward to hearing the rest of the presentations today.
Thank you, Tracey and Courtney. Our second speaker is Roma Subramanian from the University of Missouri, who will present on using social media to stomp out Ebola stigmas, an analysis of anti-stigma campaign. All right, it appears that we have lost Roma, so we're going to move on to our third paper, which was co-written by Ying Taylor Wen from the University of Florida and Zhou Yun Queenie Lee from the University of South Carolina. The paper is titled Agenda Setting and the Internet, the Intermedia Influence of Twitter on Traditional Media Coverage of the Ebola Quarantine Policy, and it will be presented by Zhou Yun.
Hi everyone, can everybody see the slides?
Yeah, we can see it.
Okay. Okay, so this is Queenie Lee. I'm a first-year doctoral student at University of South Carolina. And my co-author is Jing. Could you guys can hear me?
Yes, we can hear you. You can continue. Sorry.
Okay. So this is Queenie Lee. I'm a first-year doctoral student at University of South Carolina, and my co-author is Jing Wen, who is first-year doctoral student at University of Florida. So our research is focusing on how two media platforms interact with each other and influence the agenda presented in different platforms. So this is focusing on the Ebola quarantine policy to see the intermedia influence of Twitter on social media coverage. And I'm gonna give a little bit background of this policy. So before on October 23rd, Dr. Spencer returned from treating Ebola patient in West Africa. He wasn't really required to quarantine himself when he returned to New York City until he was diagnosed with Ebola positive. So before that, Dr. Spencer went to popular restaurants and to subways to several places. The case aroused great controversy in the public, and the government was criticized for really being involved, increasing the risk of Ebola outbreak. So the rules on quarantines had been changed to be mandatory on October 24th. Right before the Casey Hickas, we can see here, Casey Hickas, a nurse who returned home from West Africa and was quarantined even without showing any symptoms of the Ebola virus. So the information about Hickas spread rapidly through Twitter throughout the whole country after she criticized the policy on her own Twitter account and drew the criticism from the public, calling the policy inhuman. So under the pressure of mass media and also the public opinion, the government of New York and New Jersey revised a controversial policy on October 26th. And also the nurse, Casey Hickas, was released on October 27th. So within the 4 days, the policy has changed remarkably. So that's a reason why we want to see how these two media platforms influence each other, and also to see the influence on the interaction between two media platforms on what the public consider to be the major and salient issue of an event. And this is our article framework. And our research question one is, will the issue agendas presented in Twitter influence the issue agendas on the newspaper? And the research question two is, will attributes of quarantine policy change posts on the Twitter influence the attributes of quarantine policy change presented in newspapers? So we use content analysis to do this research paper, and we use Ebola and quarantine and also two doctor and nurses' names to search our data from both newspapers and social media. So newspapers includes national newspapers, which is New York Times, and also two local newspapers in New York City, which are New York Daily News and also New York Post. And of course, our social media data is from tweets. And our time period of research paper is from October 24 to October 27, which is 4 units. And we gather tweets and also newspapers articles for each unit to analyze our data. So Taylor and I do a content analysis of the 10% of the articles and also tweets to achieve the intercoded reliability. After we have the 100% agreements, we start coding separately. So how do we analyze our data? For each agenda, we have two variables. The first one is Ebola relevant issue, which includes basic information of Ebola, new evidence, and also personal stories. And next variable is government relevance, which are policy changes, policy defense, and also conflicts, action, and also reassurance. For our research question two, which is attributes of agenda. we have 4 items here, which are opportunist, human rights, and also political conflict, and also public safety. So now I'm turning to Taylor to explain our results and our discussion. Can everybody hear?
Yep, we can hear you.
Can everybody hear Taylor?
I don't think so.
Can everybody hear me? Okay.
Yeah.
Okay, great. So we use cross-leg correlations to test the intermediate agenda setting effects between newspaper and Twitter, and we look at both the first and second levels of agenda setting, which are issue agenda and attribute agenda. Since we have 4 units of time period, so there are 3 sets of cross-leg correlations, which are 24 and 25, 25 and 26, and 26 and 27. Based on our results, we found out that newspapers' issue agenda on October 24th influenced Twitter's issue agenda on October 25th because the correlations between 24th newspaper and 25th Twitter is much higher than the correlations between 24th Twitter and 25th newspaper. And when we look at the baseline here, and we find out that there is no reciprocity. And we turn to the second level of agenda setting, the attribute agenda of policy change. Twitter's attribute agenda on 24th influenced newspapers' attribute agenda on 25th. This is consistent with previous intermediate agenda setting studies. It suggests that when one medium has stronger influence on the issue agenda at the first level, the other medium has stronger influence on the attribute agenda at the second level. And the second set of the correlations, we found that Twitter has stronger influence on newspaper, and we can see here is 0.788, and Twitter's issue agenda on 25th influenced newspapers' agenda on 26th. We believe this is because on October 25th, the nurse Cassie Hickox, she posted on her own Twitter account saying that the 21-day mandatory quarantine policy infringed her freedom, and she would fight for her freedom. And this tweet went viral. Many people shared her tweets, and therefore newspapers reported this on the next day, October 26th. As we can see from this figure, we have a stronger correlation here, and instead of the newspaper and 25 and Twitter on 26. And the secondary agenda, the attribute agenda, we find out that it's consistent with our previous time slot between 24th and 25. When Twitter sets the issue agenda, and we can see here, when Twitter sets the issue agenda, newspaper will influence Twitter at the second level and sets the attribute agenda. For the last part of the issue agenda correlation, we find out newspaper on 26 influenced Twitter on 27, and we believe this is because on October 26, New York and New Jersey government decided to change their mandatory quarantine policy to allow people back from Africa to self-quarantine themselves at home. However, at the second level of agenda setting, we found out the correlations between newspaper and Twitter on 26 and 27. They both exceed the baseline 0.309 here. So we have no evidence to say that which medium has influenced the other in terms of attribute agenda on 26 and 27. And based on our findings, the intermediate agenda setting effect is found between newspaper and Twitter on Ebola quarantine policy. In most cases, traditional media, which is newspaper, is still the dominant channel for people to receive information. However, if certain public opinion in social media goes viral, and then mass media would pick up the agenda and further develop and influence social media at the attribute level. This study infers that Twitter can be seen as a powerful and important media outlet to influence the formation of public opinion, and the agenda finally contribute to the policy change. And this concludes our whole presentation. Thank you.
Thank you. We're going to go back to Roma from the University of Missouri, who is going to present on using social media to stomp out Ebola stigmas. Can you, Roma, can you unmute you?
Hi, can you all hear me?
Yeah, we can hear you.
Okay, great. So good afternoon. My name is Roma Subramanian, and I'm a doctoral student at the Missouri School of Journalism. I'd like to talk today about a social media campaign that was created to combat the stigma against Ebola. So I'd like to start just with a brief background about the campaign. Oops. So,
hi, Roma. We can't see your PowerPoint. Were you planning to pull up the PowerPoint right now?
Yes, I have screen shared it.
So something you should do is you should go into your PowerPoint right now. Just the PowerPoint, not on the screen share.
Okay.
And then do the full presentation from the beginning. I'd like as if you were presenting it in a room.
Okay, can that be seen?
No, not yet. And so once you are in a full presentation mode, you click on your keyboard on Alt and Tab, and you click on Tab, and you go to the green Google Hangout bubble. And then once you're in the green Google Hangout bubble, you let it go. Do you see that?
Okay, I'm so sorry. I'm sorry. Okay.
No, so click on the share button and then pick the PowerPoint, and then let's see if you can move it forward and backward. So on the left-hand side, you have a green green slide share button in the Google Hangout.
Right.
And then pick the window that displays your PowerPoint. And share it.
Okay.
All right, and then now we can see your PowerPoint. Let's see if you can move the slides forward. So go to the second slide and let us see. Let us know when you go to the second slide. I want to make sure it's good. So just keep it in that mode, and you can go one back so you're at the beginning and you're ready to present.
Okay, thank you. So as I said, I'll be talking today about a campaign that was created to combat stigma against Ebola. I'd like to just begin with a brief background about the Ebola crisis. So the 2014 Ebola outbreak is considered to be the largest in history. It's affected several countries in West Africa, mainly Liberia, Sierra Leone, and Guinea. According to the CDC, the number of people who've died from this virus is about 9,000 so far. And given the incredibly infectious and deadly nature of the disease, stigma against Ebola has been an important feature of the crisis. So the stigma has been directed against patients with Ebola, people associated with those patients like healthcare professionals, and also people associated with the region of the world where the crisis is taking place, which is West Africa. So as I said earlier, the focus of this study is an anti-stigma social media campaign called I Am a Liberian, Not a Virus. And the campaign was initiated by 4 women as a way to combat the discrimination the Liberian diaspora, particularly in the United States, was facing. And so Shana Solomon, one of the organizers of the campaign, created a YouTube video with the campaign slogan, I am a Liberian, not a virus, and that video soon became viral. And also, as the campaign progressed, both Liberians and non-Liberians began to post selfies of themselves, basically holding the placard with the words, I'm a Liberian, not a virus. So I wanted to analyze this campaign through the lens of stigma theory. So stigma is a concept that has been heavily researched and studied. Going all the way back to 1963, sociologist Irving Goffman was the first to define stigma as an attribute that is deeply discrediting and reduces the bearer from a whole and usual person to a tainted and discounted one. We also have an understanding of the dimensions of stigma, such as concealability, course, origin, disruption, peril. And these dimensions help to distinguish one stigmatizing condition from another. We also have an understanding of the way stigmatization occurs. So in 2001, in a seminal paper, Lincoln Phelan explained that stigma occurs when elements of labeling, stereotyping, separation, status loss, and discrimination occur together in a power situation that allows them. And finally, there are different types of stigma, like self-stigma, structural stigma, public stigma, and courtesy stigma. So there's also been research on strategies to combat stigma, and prominent among them are protest, contact, and education. And I also wanted to analyze this campaign through the lens of image repair theory. So that brings me to my research questions. So my overarching research question for the study was, what anti-stigma and image repair strategies did the campaign use? What dimensions of stigma did the campaign address? And then what types of stigma did the campaign address? The method I used for this study was an interpretive textual analysis. So I looked at Facebook posts from the campaign's Facebook page, I'm a Liberian, not a virus, and I also looked at tweets with the hashtag, I'm a Liberian, not a virus. And both the posts and the tweets were coded and categorized using a constant comparative method. And so I found that the prominent anti-stigma strategies that were used were protest and contact. So this is a post from the early days of the campaign, and the post says, we are not the latest news break, we are not those Africans, we are not numbers, statistics, and projections, we are mothers, fathers, children, scholars, artists, doctors, fighters, survivors, and people. And so the underlying theme of this post is one of protest, in the sense that the post is raising awareness about stigma against Ebola, and is also kind of reprimanding people who engage in stigmatizing actions. Also, by putting a face on the epidemic per se, the campaign also helps to increase identification with Liberians and reduce othering and increase empathy. Another strategy the campaign used was one of bolstering. So in this post, the individual is kind of generating pride among the Liberian community, and so encouraging Liberians to not focus on the problems with their country, but kind of celebrate their successes. Another way to bolster was by fostering solidarity. So in this post, the individual is talking about encouraging Liberians to kind of band together and fight against discrimination on the basis of Ebola as a unit. This is a tweet which talks about a candlelight vigil for Thomas Eric Duncan, who was one of the first Liberians to die from Ebola on American soil. And again, the sentiment of solidarity can be seen in this post through the words, let us not forget that injustice to one is injustice to all. Solidarity was also fostered by encouraging Liberians, both in the United States and abroad, as well as non-Liberians, to take pictures of themselves with the campaign slogan as a way to kind of show solidarity for the campaign. And bolstering was also achieved by kind of showing the progress that Liberians were making in tackling Ebola. So in this post, a journalist writes about how impressed he is with the calm and practical attitude of Ebola workers, and how he's confident that with enough resources, Liberia can combat this epidemic. This is another post from about a month ago. It's actually an excerpt from a news story, and it says that Liberia is making progress in combating Ebola, and now Ebola is just limited to 2 counties. The final strategy that I'd like to talk about is attacking the accuser. So the accuser in this case was the media, and so in this post, there is talk about how the media is responsible for spreading misinformation, myth, and prejudice, and it's not doing a very, very good job in kind of controlling the fear surrounding the crisis. Another way to kind of attack the accuser was by making it very clear that Liberians were the victim and not the cause of the epidemic, and they did not bring this upon themselves. Another way to kind of talk about, to kind of again attack the accuser was by talking about the consequences of stigma. And so in this post, there's a talk about how West African children are being bullied and banned from their schools, and also how flights from the region, to and from the region, are being disrupted. And finally, there was a lot of irritation about poor education or lack of awareness about Africa. So the context for this image or map is an incident in which a teacher in a school in Kentucky was asked, who had just returned from a trip to Kenya, was asked to put herself under quarantine. And so the map was created to kind of tell people that, you know, Africa is a huge continent and not just one big country, and also that there were no cases in Kenya, and also there was considerable distance between Kenya and West Africa. And so to conclude, I found that the main anti-stigma strategies that were used were protest and contact. It is surprising to me that in the posts and the tweets that I've looked at so far, there doesn't seem to be a tremendous amount of education about Ebola in terms of how is Ebola spread and how can transmission be prevented. In terms of image-aware strategies, the main strategies were bolstering and attacking the accuser. The main types of stigma that were discussed were self-stigma, public stigma, and structural stigma. I think it's really noteworthy that both the campaign organizers and participants of the campaign emphasized the root causes of the Ebola outbreak, such as poverty or lack of resources or economic hardship, instead of just focusing on the proximal causes of the crisis. Again, it's noteworthy that the dimension of stigma that was focused upon was origin. Research shows that attribution of responsibility is a key topic to talk about in terms of when dealing with stigmatizing issues, because if individuals are considered to be responsible for their crisis, they are more likely to be stigmatized. So in future studies, I'd like to continue to look at the evolution of this campaign on social media and see how the messages change as time evolves. And I'd also like to perhaps look at the Liberian diaspora within the United States, and perhaps through interviews and surveys, understand how they have been affected by this campaign. That's it. I'm happy to answer any questions later.
Thank you, Roma. After Michael, we'll have questions. So our last speaker for this panel is Michail from Pennsylvania State University. He will be talking about conducting effective online public relations in the midst of a health crisis.
Hi, can you hear me?
Yes, we can hear you.
Let's see if you can see my PowerPoint.
Okay.
Can you see the PowerPoint?
Yes.
Okay, so hi everyone, I'm Michail Vafeiadis from...
Can you try to go back and forth between a couple slides so we can make sure that works?
Yeah, sure, I'm sorry.
Are you moving to the second slide?
Yep.
Yeah, we can't see that.
Okay. Should I start?
No, we can't see that. What do you want to do?
Hey, Michael.
Yes.
Can you move to the second slide? And let us know when you did that.
Yes, I just.
Yeah, it doesn't display that you're moving, so add the slide share.
Okay.
Oh, now we can see it. Now you're good. So now it's doing it.
Just delay.
Might be a delay.
Can you see the slides now?
Yes, we can see it. So you're all good to go now.
Okay. Okay, sounds good. Hi again, everyone. I'm Michail Vafeiadis from Penn State University. Before I begin, I would like to thank the organizers of the symposium, and particularly Dr. Messner. Today, I'm going to talk about a very timely topic, that is, what response strategies are more effective in social media during a health crisis. So, the introduction of social media and the simultaneous rapid dissemination of information makes urgent the re-examination of existing crisis response strategies, since past studies have only examined them in non-interactive media ecosystems. This line of research is crucial, as constructing effective crisis response strategies can mitigate potential damages to the reputation and credibility of an organization, but it can also safeguard stakeholders' trust and behavioral intentions towards the organizations. Research suggests that during crisis events, social media use increases as people go there to, for instant access to information, as well as for sharing updates. So, when stakeholders are not properly updated about the crisis, they tend to resort to sources other than those provided by the affected organization. As a result, this can advance the rapid dissemination of misinformation that can eventually damage an organization's image. So, what is our study's contribution? Public relations practitioners need a new line of research that will shed light on the type of crisis responses they should utilize during an unfolding crisis. The recent Ebola outbreak, as well as the measles crisis, emphasized the importance for health organizations to have a contingency social media crisis toolkit. And in the internet era, the real challenge these days for an organization is not determined by the magnitude of the crisis, but by the type of the responses it provides to audiences. So here are our research questions. Research question 1, how do the crisis responses of apology, sympathy, and information disseminated over Facebook influence the reputation of a hospital in crisis? Again, how the same crisis responses influence perception of trust of a hospital in crisis, how they influence the message credibility for a hospital in crisis, how they influence the potential behavioral intentions of a hospital in crisis, and finally, how does the use of Facebook influences perceptions of reputation, trust, and message credibility of communication over Facebook for a hospital in crisis. So, given this is our research design, given the importance of trust, credibility, and reputation in healthcare, this study aims to identify effective crisis response strategies for hospitals. In that vein, a fictitious hospital was used to control for potential biased responses based on personal past experiences, and each participant was randomly assigned to one of these 3 conditions. Now, our first stimuli, was the apology message, which reads as, "We accept responsibility for the incident that occurred this week, resulting in 9 deaths. We hope those who were affected can forgive us." Now, the sympathy message. "We are deeply saddened by the incident that occurred this week, resulting in 9 deaths. Our thoughts and prayers go out to those affected." And finally, the information message reads as, "On April 7th, 4 patients, a nurse, and 2 doctors died from a highly contagious virus. The hospital is investigating the cause of the outbreak." Now, the results indicated that the strategy of sympathy resulted in a lower post-crisis reputation evaluations than the conditions of information and apology, since crisis response strategies can reduce the reputational damage by allaying negative emotions as they are produced by stakeholders. The sympathy conditions should be avoided by crisis manager. With regard to organizational trust, the response strategy of sympathy scored lower than the conditions of information and apology. So we believe that public relations professionals and organizations in the health sector should pay considerable attention, since a decline in trust levels is often associated with a decline in confidence, competence, honesty, openness, reliability. Also, the deteriorating trust levels can increase for an organization cost for business operations, since they tend to persist over time. The information strategy, as you see here, resulted in higher valuations of message credibility than the strategy of sympathy. Nevertheless, neither of them was significantly different from the apology condition. So it appears that the process of stealing the thunder, which is if an organization quickly self-discloses negative information about itself, results in enhanced credibility and message persuasiveness. So with the introduction of social media, organizations in crisis should rapidly convey information to stakeholders in order to frame the message and the crisis. Now, regarding behavioral intentions, the findings indicated that it is more likely for stakeholders who receive an information message to share it and inquire for additional information than those who received the sympathy message. The findings also indicated that people are keen in commenting on the sympathy response, as you see here, than on the strategies of apology and information. Similarly, individuals who received the sympathy condition were more willing to discuss it here, the received message, than those who viewed the information or the apology response. However, I should say that these findings should be interpreted with caution, as commenting can be used by stakeholders to voice their discontent. Past studies have shown that the internet facilitates the creation and the propagation of negative word of mouth. And finally, it was also found that the frequency of Facebook use significantly influenced only stakeholders' perceptions of message credibility. This is not surprising, I should say, given the profusion of information Facebook users receive around the clock. So now the sympathy condition produced a lower post-crisis reputation, trust evaluations, and higher secondary crisis reactions, as I mentioned already, negative word of mouth. And given the fear of lawsuits, and an apology message can bring, along with the negative repercussions which are entailed in a sympathy message, practitioners and organizations should refrain from embracing and uploading sympathetic messages on their organization's website page. Finally, I will conclude with some recommendations for public relations practitioners in the health sector. First of all, they should raise this question: what social media does your organization use? They have to make sure they understand those platforms and establish a presence on them. They should also timely post counter statements to false rumors or provide links with the accurate facts. They should look at other organization strategies, and particularly to their success and their failures. Also, they should educate and train an eclectic team which will be in charge of social media in the event of a crisis. They should customize their messages according to the platform's affordances, because different demographic groups have different social media preferences, and that's important to consider. They should also provide a roadmap of action for the public with all the steps the organization plans to take to address the situation, both in the short and the long term. They should also have a designated crisis spokesperson for media, as well as a dedicated crisis response team for social media 24/7. And they should participate in any crisis preparedness drills which are scheduled in their organization. They should craft messages and test them with both internal and external stakeholders. And finally, our last recommendation is that they should be ahead of the game and educate the public early on in the crisis before things escalate by providing accurate facts. They not only avoid misinformation from spreading, but they can also win their stakeholders' trust, and they can establish themselves as an accurate and transparent source for their information. And that's all. Thank you so much for your attention. Please let me know if you have any questions.
Thank you, Michail. And thank you to all of our presenters. We will now have our discussant, Brooke Fisher-Liu from the University of Maryland, join us with some feedback to our presenters.
Hi, everyone. Can you hear me?
Yes.
Great. I really enjoyed seeing your PowerPoints earlier this week and then hearing them from you guys just right now. Rather than touch on general themes across the papers, like sometimes discussants do, I'm just going to go into some recommendations for each paper individually to save some time. So I'm going to go in the order that you all were supposed to present, not the order that ended up being presented today. So I'll start with the systematic review that Tracey and Courtney presented. Obviously a very timely topic, and actually the first lit review I've seen on this topic that takes this approach of a systematic review. So it was really great to see that you actually did intercoder reliability and took a more scientific approach to looking at the literature. With that being said, I do have some recommendations for improvement. First of all, there are a couple of other literature reviews already published on the same topic, specifically one in 2012 and another one in 2013. I'd be happy to send them to you offline. And I didn't see recognition of those literature reviews and specifically how your work is moving the field forward versus perhaps maybe replicating what's already being done. I also would have liked to have seen a bit more on the intercoder reliability stats themselves. It's great that you did that, but what was the actual reliability achieved, or was it more a verbal agreement? I think it also would be great to hear a little bit more about how your coding sheet was developed, and I think that goes back to my recommendation about looking at other similar literature reviews. You know, why did you pick these topics to code and not others? I think that there might be some more detailed topics you might want to consider coding on, things like the extent to which recommendations are given, which you told us they weren't. Maybe go a step further and tell us what are the best practices that have been recommended. What are the specifics of the details, given that you weren't able to provide that much depth with your quantitative analysis. I also did pause at the number 25. Looking at your slide where you obviously looked at a lot of different databases and it was clear you did your due diligence, but just counting among my colleagues, I'm pretty sure that my research group has published more than 25 studies on this topic in that time frame that I would think would have been included in this study, and I'm not alone as publishing in this research area. So I'd really double check to make sure you didn't miss some research that might add some more flesh to what you did. But again, a really great study, and I really do appreciate the systematic review, which is incredibly rare in our field of communication and mass communication. Moving on to the Ebola Stigma paper, also a great paper, and I think what's really unique about this one is it's a new theory. There is a lot of stigma research in intergroup communication, but I haven't ever seen it in crisis or risk communication research, so I think it's always great if we can move our field forward with new approaches and new lenses. I think the major recommendation I have for this paper is in crisis communication research, we're increasingly moving away from descriptive to evaluation. And so we have great rich detail here on what happened. We need a little more on what publics or stakeholders reacted to. So even not doing the next step, your future research, which was great, talking to the communities, But even with the data you had, were certain messages more likely to be retweeted, liked, shared? Can you give us any sense on how these strategies played out other than just that they were used? I also wondered if you did some analyses comparing the verbal strategies versus the visuals. It seems like there are a lot of pictures that were tweeted or posted on Facebook, and I wonder if you did any kind of comparison between those two. I know of a grand total of 3 published articles in visuals and crisis communication. So I think that's a really under-tapped area of research in our field. And with this data set, I think you could easily do some research surrounding that topic. The final recommendation I have, and I'm 99.9% sure this was due to a lack of time, but more depth on the actual qualitative method. As someone who publishes in quantitative and qualitative research, it's not enough to say constant comparison. We need a couple of paragraphs should this move forward into a journal article on exactly what you did. There's still is some pushback in terms of the reliability and validity of qualitative research, and I'm sure you know that, but just add a little more depth there. Maybe looking at Miles and Huberman and Saldana or Corbin and Strauss, where constant comparison is just one of dozens of techniques we have in our qualitative research toolkit. But overall, an outstanding paper, and I think definitely a very promising research stream to come out of that one. The third one, the agenda setting paper on intermediate influence, was also very strong methodologically and with theory as well. So that's a real strength of this paper in my perspective, that the theory was very strong and the execution was also excellent. In terms of suggestions for improvement, I think it's really interesting that you looked at the Intermedia agenda from Twitter to newspapers. I wonder if you consider looking at the reverse, newspapers to Twitter, and how that might affect your findings. I think in terms of the research method, quantitative made perfect sense. I wonder if you could go back and deepen it a little bit with some qualitative findings on the how. So we know what happened. What was the exact impact? How did this change what the newspapers were covering because of the intermediate agenda setting between Twitter, beyond just the numbers, giving us maybe some more quotes from the sample or something that we can sink our teeth in to a bit more. On a nitpicky note, but something worth noting, you have TV in your research questions and it's not in your data set. So you apparently did not analyze TV, only newspapers. In terms of the method, this is most likely another timing constraint, but I would have liked to heard a little bit more about your coding sheet, how it was developed, why you picked those selected items, and more about your intercoder reliability as well here. In terms of the tweets, again, time probably didn't permit, but what was your sample? Which tweets did you select? Was it the public? Was it health organizations? Was it responding organizations? Was it a random sample, a constructed month, a constructed week? Just more detail there would be great. And finally, in your discussion, I think you made some really, really good points. Here again, I would look at some more depth. We know, for example, that Twitter has issues go viral. That's pretty common sense now. So maybe more exactly how did it go viral? What were the specific mechanisms surrounding that you can glean from your data? So going a little more depth and not quantitatively confirming what we already know as common wisdom, which has value, but adding perhaps some more new knowledge as well. For the next one, the effective online public relations in the midst of a health crisis. Another excellent study, extremely well executed in terms of design. Here I would have liked a little bit more of the theory. I'm pretty sure you had some theory. Situational crisis communication theory seemed to be represented, for example, in research question 3. But it wasn't out there, and I think that it's important, even when you're collaborating with industry partners like you did, because by putting things together in a theory, we can help start having our studies combined to the same body of knowledge. If we all test things individually and don't contribute to the same theory or body of knowledge, we really can't move our field forward very effectively. So I would have liked to see more explicit treatment of theory in the study itself. In terms of the experimental stimuli, I pause a little bit at the vague, the incident terminology. I'm sure you debated whether to have a specific incident or not. I'm sure you picked the vague, the incident for a reason. And probably increase your internal validity, but it has zero external validity. When we work in the real world, a tweet is going to be accompanied by additional tweets or additional coverage that tells us exactly what happened. And so we know from situational crisis communication theory, for example, how responsible the public thinks the hospital might have been for the crisis is dramatically going to affect how they respond. And so I think by taking crisis responsibility out of the equation, the findings aren't quite as meaningful. I also really appreciate, and I think it's a strength of this study, that there are very specific, concrete recommendations provided to practitioners. I think we should always be doing that. I would just temper the language slightly. They might be a bit too concrete from a single study. So unless you can show, a body of research, other studies that found the exact same things, I wouldn't be quite so directive in our research. We don't want to give practitioners poor advice or have them not trust our research findings down the road. Finally, I was really intrigued by your slide on behavioral intentions, and I would have liked to hear a little bit more about your interpretation of that. What does it mean, for example, if hospitals want to foster engagement in Facebook, and the activity of liking was the one that you found was not significant, and we know from other research, most of what we do on Facebook is like. So what does that mean in a crisis response? If you're trying to get your publics to engage with you, what can you do about that? So a little more depth there on the findings again, and going beyond the kind of conventional wisdom of what we already know works. And I think, again, your behavioral intentions findings are unique and not something I've seen before, and that you could probably go a little more depth on that. So overall, I think all the papers were very strong. I'm happy to talk offline with any of you if you want my feedback. I have it typed up if you want it in writing or if you want to follow up. And I think now we can open up for questions from others.
Thanks for your feedback, Brooke. Do we have any questions, Scott and Osita, in the audience room or from Twitter?
Yes. We are. This is for Roma. Which social media platforms are primarily used to combat Ebola stigmas, and why? And I think that we can probably take this question a little bit broader, maybe to everybody, and see what other people's opinions are on the strengths and weaknesses for some of the popular social media platforms for health crisis communications.
The platforms that I kind of came across were mainly Facebook and Twitter. So I didn't, I guess I don't really have a comprehensive answer to that. Just kind of my survey of the campaigns against Ebola stigma, the ones that I saw mainly used either Twitter, Facebook. I saw some YouTube campaigns, but those were generally the media that were being used.
Does anybody else have any thoughts? Scott, any other questions?
No, there are not. And looking at the schedule, we might need to wrap it up.
Okay. Well, thank you, everyone. Please continue the discussion on Twitter with the hashtag VCU Global Health. We will now take a very short break, I'm guessing, and please join us for our next panel, which should be starting in 10 minutes at 2:45. Thank you.